Hello friends, welcome back to Complete Medical Coding. Today let's discuss about the respiratory system. The codes for respiratory system we'll be discussing in this chapter, and only there are few terminologies that we need to notice and not much guidelines, same like the musculoskeletal system. And the range of the series, this will be the 3 series. Respiratory system, cardiovascular, everything will be the 3 series. But the range of respiratory system is from 30000 to 32999. We will just move on to some terminologies. We need to remember some terminologies in this chapter. So let's have a look into it. Epistaxis, it means nasal hemorrhage. Septoplasty, it means septal repair in nose if septum is deviated. Rhinoplasty, it's a procedure to change the shape of the nose and improves breathing. Both septoplasty and rhinoplasty both helps in improves breathing, both the procedures. Now there are 4 different types of paranasal sinuses: maxillary sinus, frontal sinus, ethmoidal sinus, and sphenoidal sinuses. Maxillary sinuses is the largest paranasal sinuses under the eyes, and it's in the maxillary bones. Frontal, it's superior to the eyes and it's in the frontal bone. Ethmoidal, it's between the nose and eyes and it's within the ethmoid bone. Sphenoidal sinuses is between the ophthalmic and maxillary nerve and it's in the sphenoid bone. So all these 4 sinuses are just located as per the respective bones. Here's a picture that just shows the exact location of all those 4 sinus. So these are just the basic terminologies that we need to remember. Now let's move on directly to some practice questions. Code for bilateral nasal endoscopy with total ethmoidectomy. So here the question is to code for the endoscopy with total ethmoidectomy. So you need to check for the nasal endoscopy. Go to the index page and check for the endoscopy. Nasal endoscopy. You will come to this code 31254. If you can check the code 31254, it's nasal or sinus endoscopy, surgical with ethmoidectomy, partial. But our question is total ethmoidectomy. So we will use the next code 31255. That is not an add-on code. Okay. So 31255. That will be ethmoidectomy total. And here in the question it's written bilateral. So we will use the modifier 50 as the bilateral code. For the modifiers, I'll be taking the next chapter for modifiers only. So from there you will be getting what are the modifiers, common modifiers that we are using, what are the anesthesia modifiers that we are using. All those I'll be explaining it in the next episode. So here for total ethmoidectomy with bilateral nasal endoscopy, you will get the code as 31255 and 50 modifier. Next one, code for thoracoscopy with wedge resection of lung. So we need to check for thoracoscopy. If you will go to the index page and check the code for and check the page for thoracoscopy, you will end up in 32650. That is thoracoscopy, surgical with fluorodesis. But our question is with the wedge resection of lung. So below that, under 32650, when you will check, it will end up in 32666, which is thoracoscopy, surgical with therapeutic wedge resection. So there it's written wedge resection, unilateral. In the question, nothing is written unilateral or bilateral. If it is written bilateral, we will use the code, the modifier 50. Okay. Next one, code for scalpel excision of polyp from inside the nose performed in the physician's office. So if you will check the code for scalpel excision, you will get 30110. Excision nasal polyp simple. To report bilateral, it's mentioned there, to report bilateral modifier, you need to use the bilateral procedure, you need to use the modifier 50. But this is just a direct code. And see on the bracket it's written, it's mentioned 30110 would normally be completed in an office setting. So in the question it's mentioned there as physician's office, means office setting. If it is a hospital setup, we will use the next code 30115. Extensive, and it's available in a hospital setting. It's written in the bracket in the CPT code book. Okay. Now moving on to the next question. Code for flexible bronchoscopy with cell washing, brushing and biopsy. So here there are three procedures. Bronchoscopy with cell washing, brushing and biopsy. So first you need to check for the bronchoscopy code, which will be 31622. That is bronchoscopy rigid or flexible, including fluoroscopic guidance when performed. About fluoroscopy and all, it's not mentioned, so just leave it. So bronchoscopy, that will be the first code, 31622. Then with cell washing, brushing and biopsy. So this is with the cell washing, 31622 code. If you will read it fully, when performed, diagnostic with cell washing. So bronchoscopy with cell washing, that will be 31622. Now brushing and biopsy also mentioned. So that also we need to code it. So it will be the next code, 31623 with the brushing. So brushing has come. Now 31625 with the bronchial or endobronchial biopsy, single or multiple area. So biopsy also written, so we need to code for biopsy. And then since this is a multiple procedure, we will use the modifier 51 along with the two add-on codes, 31623 and 31625. Okay. So we will not use the code, that modifier for the primary procedure as per the guidelines. So this will be the code. Cell washing, bronchoscopy with cell washing, 31622. Brushing 31623 and biopsy 31625 along with modifier 51 since it's a multiple procedure. Next one, code for removal of pebble from child's nasal passage performed in the physician's office. So removal of pebble from child's nasal passage. It means removal of some foreign body from the nose. This is a simple direct question. If you go to the index page, you will get removal of foreign body, intranasal office setup. It is in official setup, physician's office. So you will get the code as directly as 30300. Next question. Patient treated in an emergency department for severe epistaxis. Physician performs extensive anterior packing. Bilateral. What will be the code? So this is a bilateral procedure, so we'll use the modifier 50. And patient is in the hospital for epistaxis. So you need to code for epistaxis. What is epistaxis? Nasal hemorrhage. So you need to check for the nasal hemorrhage code. So you will end up in 30903. Control nasal hemorrhage, anterior, complex, extensive. Because in the question it's mentioned extensive. So it will be extensive anterior packing. Bilateral. So we'll use the modifier 50. Next question. A 70-year-old male patient is suffering from spontaneous pneumothorax for past 2 years. He visited the doctor for chest discomfort and the surgeon decided to perform open chemical pleurodesis. Code the appropriate CPT code. So here, what is the surgeon performing or decided to perform? Chemical fluorodesis. So you need to code for the fluorodesis only. So if you go to the index page, you will check for fluorodesis and you will directly get the code 32650. And one last question. Here, it will show too much stories. It will mention too much stories about what's the procedure or how it is done, everything. So don't be scared looking into the question, and don't think that the question is so big, so the codes will be also more. Don't think like that. Okay. So just understand what is the question regarding and what is the procedure regarding. A 54-year-old patient who is having a chronic pleural effusion. So the patient is having a pleural effusion. That is the procedure. Okay. The physician removes fluid from the chest cavity by puncturing through the space between the ribs. Now, the remaining part, it is just mentioning how the procedure is being done. Okay. To enter the chest cavity, the physician passes a trocar over the top of a rib, punctures through the chest tissues between the ribs, and enters the pleural cavity. This is how the physician enters the pleural cavity with the end of the trocar in the chest cavity. The physician advances the plastic tube into the chest cavity. The sharp instrument is removed, leaving one end of the plastic catheter in place within the chest cavity. That point is also important. So, the sharp instrument is removed, leaving one end of the plastic catheter. It means one plastic catheter is also in place with the chest cavity. In the chest, the physician has inserted one plastic catheter. A syringe is attached to the outside end of the catheter, and fluid is removed from the chest cavity by pulling back on the plunger of the syringe. The outside end of the tube is connected to a water seal system to prevent air from being sucked into the chest cavity and to allow continuous or intermittent removal of fluid. What will be the code? The remaining all, it's just mention how the procedure has been done. So here we need to check. The main thing is pleural effusion that we need to code. And then in between, it's mentioned physician has inserted one plastic catheter. So you need to code that. So first go to the pleural effusion. Check for pleural effusion code. You will get it as 32550. Insertion or indwelling catheter with the cuff. No, we don't want, it's not written mention about cuff. So when you check, this is a pleural effusion. Pleural effusion, you will end up in 32556, which mentions pleural drainage percutaneous with insertion of indwelling catheter without imaging guidance. So with insertion of catheter, that is important. That's why we will move to the code 32556. Pleural effusion with insertion of catheter. So this is how questions will be. It will be a little complicated, but it mostly mentions the story, means how the procedure is being carried out. So we need to just figure it out what the procedure is done, exact procedure is done, and then we need to check the code. So that's all for today. That's all for the respiratory system. And let's move on to modifiers. I'll take the modifiers in the next episode, which will be helpful for you when you will go through the next for the upcoming episodes. Okay, so thank you so much, and let's see you on the next episode. If you like the video, please share it and subscribe to my channel. Thank you. Bye.